You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. This is a special edition, and it's kind of breaking news we have here today. My first guest is a neurosurgeon, spine surgeon, well-known all over the world, and we're talking about the end of back pain, possibly, and neck pain. It may or may not be an overstatement to say that, but with us we have an expert on the topic. We've had him on the program before. I've also had him on the Randy Alvarez podcast for a long version. Very interesting. And this is a real interview. I'm just asking the questions. I'm not endorsing him today, but I think, look, if you've got back pain, neck pain, you've got to hear what he has to say. And especially if you've been told you need a fusion surgery, because there's apparently more than 500,000 or even 1 million of these surgeries being done with opening up your back, huge downtime, huge recovery, and now with small incisions, not tearing apart the muscles or the tissues, he's able to do it, in some cases, in about a half an hour. So with us we have Dr. Hamid Abbasi. Dr. Abbasi, welcome to the program. Welcome back.
Always a pleasure to be here in beautiful Carlsbad, Randy.
Now, you have your cell phone on the desk. We may get a surprise call because I said, well, what are the people? Because what takes other guys 7 hours to do, let's say a fusion surgery, you're doing in 45 minutes or under 30 minutes, and even complex scoliosis surgeries. And I said, I mean, these people that work in the ORs, the operating rooms, they must be surprised. You said, I'm going to have a guy call. You ask him yourself.
Yeah, it's a team, truly a teamwork. Now, no captain in any ship can navigate all by himself. You have to put a good team together, and in places we have been, we have that good teams together, and that team helps me to deliver this kind of care at the level that is unheard of for the spine surgery. And the result are patients that benefit from the surgery without going through the downside of the surgery, which is like being intubated for 5, 6, 7 hours. And that teamwork is extremely important. But so I called my OR today and I said the person who's usually scrubbing with me, and he's a very competent person.
Now the scrub tech, just so
scrub tech, yeah.
So these are not medical doctors, but these are the people. What do they do? What's their role? Because we've all seen the medical shows in surgery. Yeah. What's a scrub tech?
Well, he's like a first mate on a ship. He truly runs the show where the surgeon is concentrating and performing the surgery. He needs lots of help, instrument. The scrub tech put the right instrument together in an order that for us to perform the surgery properly.
And the reason I want to talk to him, because you said because there's two, we're talking about fusion surgery today, right? It's a new type of fusion surgery. There are only 30 guys as of today's date.
Around, yes.
Around 30 in the world. Is that fair to say? In the
world?
Yeah,
it is fair to say.
That are able to do it this way.
Yeah.
And you said that this guy that may call in, that he witnesses other 6, 7 hour surgeries.
Yes.
And then he sees yours for the first time. And what do they say? Like they go, what?
He says that's his favorite kind of surgery. He understands that this is a highly specialized kind of surgery.
No, but when he first saw your surgery, under 40 minutes or so, as opposed to 7 hours.
Well, he was truly speechless, I believe, because he didn't tell me anything the first. But now that we grow more like friends, he tells me that his favorite surgery, and he doesn't want to be in any other kind of spine surgery. But I think it takes a little to sit in that the surgery, that the way we do it, what it really does to the patient, and all the blood that you don't lose, all the time you don't have to cook the tissue to stop the bleeding. And he understands that the elegance of the surgery itself, there's a beauty of doing things simple and efficient. And that is where we are. We do it very efficiently.
So people know what we're talking about. Okay, so spinal fusion surgery, right? Lots of hardware, you fuse the spine. And just correct me if I'm wrong. So people know exactly what we're talking about. Typical surgery, you got to cut open hundreds of muscles, 100 plus muscles, that never get attached again, like the girdle that holds your whole body together. You cut those muscles just so you can have access, so the surgeon could see and place the hardware and fuse a spine. And it takes 7 hours because you've got to meticulously, or in a sloppy way, you've got to detach all these muscles, then you've got to put them all back together. You have to control bleeding, as you say.
Yeah.
So it takes like 7 hours. Very risky surgery. In fact, if you're like 60, 70 pounds overweight, you can't even get the surgery. Then there's another way to do it.
Yeah.
And which is the way you're doing it.
You know, I couldn't describe it better. In a regular surgery, you know, anatomically, we call them paraspinal muscle. We give them one name, or we call them multifidus muscle. We love giving them based on their function names, but in truth, each of those muscles, they are hundreds of individual muscles.
They have a function.
They connect to different areas, different bone area, and they have a different function. We put a knife down and cut them and separate them from their point of origin, like no different than if, imagine the orthopedic surgeon would open your shoulder, but cut all the muscles. But that is a part of that. We have been doing it for a long time, but something that we don't say often. In a spine surgery, we do not reattach a single muscle back.
You don't. So these people...
No. They float, and eventually they turn into scar and die.
Okay.
This, even though we give them few names, in reality, as you said, there are hundreds of individual muscle that each have their function. There is a reason for them to be there. We render them useless.
So when you do it today, right? You're going in through what, 6, 8 holes? How many little holes?
Well, depending on how many levels we do the surgery, and that's one of the things that I tell my patient, that it's not about how many holes we use. It's about what we achieve and what happens afterwards.
Like 6 or 8? Is that what we're looking at?
If we do it like I just did a multiple of these kind of complex surgeries where we did 3-level fusion. For 3-level fusion, I use usually one small incision to get to the bad disc, but then each screw individually has its own hole, so 8 holes for the screws to put the screws in place to stabilize. But the idea is, and I showed you a picture of that after the surgery, once we are done, and once we take our devices out, because we don't cut the muscle, we just dilate them and they fall back. Practically that area is scarless. There is no scarring or damaging to the tissue. Once, one of the ways I have been able to really impress my colleagues is actually when I bring them to our cadaver labs. Once we do the surgery, we take the tissue layer by layer off on our porcine lab, which is a pig model, or our cadaver lab. We truly take them, the layer by layer, we take the tissue off and we show them what structure did we go through to get the job done. It is hard to see even what is the path of the instrument we take, because once they fall back, they peel themselves very beautifully, and in that area, people heal scarless. Inside, the muscles just turn back to their function right away.
So I guess there's one way to access the spine for the fusion, to cut everything out of the way, make room for it.
Fillet patient open.
Fillet them open, as you say.
Yes.
Or to go in, I guess, are you doing it under fluoroscopy or some sort of?
Yes.
Okay.
Yes.
To go in, like using some sort of tools, right?
Yes, very specialized tools.
Specialized tools, to go in and actually just kind of push things out of the way instead of cutting them out of the way. Is that kind of what's going on?
You just described it. What I do.
Well, you taught me a little bit about it. I want to make sure that I understand it. So so you have a way to just kind of push things out of the way.
Yes.
Get done, get in and get out, and that's
It's about instrumentation. It's about very specialized instrument that enable you what would be impossible even 10 years ago. It's about no different than the watch you have in your hand. It's magic what that watch does. But all what it is an instrument that designed very specifically at highest level to do certain thing for you. Like you just told me that measures the oxygen level in your blood.
Yeah, the newest Apple Watch, yeah.
That would have been the device that we had 10 years ago to do that, would have been almost filling this table.
Yeah.
And now it is on your wrist. So what we are trying to do to take a complex task and make it easier based on what the instrument provide to us. Like You drive your automatic car, and you don't think about gearing, changing the gear, and paying attention to at what speed. I used to do that. Have to pay attention that at the right speed.
The clutch, the stick shift. Now most people drive automatics.
We don't do that anymore because the machine, the instrument, took care of that for us, so we can concentrate on the road. And this is what we have been doing with very specialized instrument, make them so specialized, so much more efficient that
it's like automatic.
Like we make it automatic. So making it automatic, it reflects in our efficiency to be able to do this kind of surgeries.
Okay. Now we should mention how many spine fusion surgeries are done a year? Approximately.
In the United States, more than 1 million spine surgeries are done a year. Half of them, more than 500,000 of them, are actually spinal fusions.
So 500,000 spinal surgeries every year. Okay.
Yes.
Of those, in your opinion, and those are all done open, 7 hours at the table, losing a half a gallon of blood, complications, deaths, things like that. How many of those do you think could have been done this new minimally invasive way?
Depending on the level of the training of a surgeon. I mean, when I started that, I started with doing only 20% of my surgeries this way because my level of experience wasn't adequate enough. Now I do more than 95% of my spinal fusions with this technique because as the time goes on, my repertoire of my skills and knowledge that I can draw on has grown to a point that I can do scoliosis with the significant side bending of the spine or things that are more complex this way. So it's all depending on the level of your expertise.
I told you on my podcast that I interviewed a doctor, another spine surgeon that knows you, called you a mad genius, but he also said you were the fastest in the world at this procedure. And I tried to put you on the spot in my green room. I said, are you the fastest in the world? I call it efficient. I said, but are you faster than anybody else doing this? Well, I call it efficient. But the truth is you are faster than anybody else right now doing this. I mean, your record right now is what, about 36 minutes?
Well, actually, for one level, we don't officially keep record.
Okay.
Though I have been told, no, I don't.
Okay.
We have a database. We gather all of our data. But this is the truth that we know everything about this. This is why we are good at. We keep track, and we keep track to not only the time spent on the surgery, blood loss, everything to the finest, the minute details of the surgery. We keep track. We go analyze it, and we get better at that. We have done this surgery in 22 minutes.
Wow.
Now, this is something on the side that I just got aware of that the staff in the OR actually keep bet about how fast we are going to be in the surgery. What I tell my patient is not about being fast. It's about getting the job done. And that job, for me, I say my patient and my staff, I don't perform surgery. Surgery performs me. Because surgery for me is a time machine. We get so concentrated, we get in to the zone. Once we get everything is in place, we have a good team, everything is in the right place. I start the surgery, and then all of a sudden surgery is done. And but I have been told jokingly that staff keep a bet on how fast we are going to be that day.
Now, traditional fusion surgery. The part I don't understand, we're kind of short on time, but they go in through the obliques, or they go in through the stomach sometimes?
There are multiple.
And the back, so they're going through two areas?
There are multiple ways of going there, but it's still more than 75-80% of the surgeries are performed from the back, where we fillet you open.
You have a picture. Let's go to that picture. I'm looking, what am I looking at here?
You're looking at the on one side traditional spine surgery where there is a midline incision, meaning in the middle the skin is open. All the muscles are filleted actually open, and you are looking at the structure of the spine itself. And on the other side, we are able to see some screws that are poking through the skin. These screws are not cutting the muscle. They are actually dilating the muscles, and they are going inside of the spine. Practically, once the top part of that screw comes off, the muscles retract, they are back where they are, and that area is scarless. And
so look, the only reason why people would want to get spine surgery or a fusion surgery is because they're in a lot of pain, right?
Some of
How
these
do
patients,
you stack up pain-wise? Do you think you also, not only is it done quicker, safer, low downtime, et cetera, they could, in some cases, walk that same day. What's the success rate? Would you say it's even better?
yeah. Well, if the success in medicine is not accumulated in one number.
Okay.
We have the scientific way of measuring the success in the spine. We call it OSVES-3 for the lower back. We call it neck disability index for the cervical or neck spine. But more or less, that is, I think, one of the things we do. We gather those data. We don't
So
do
to
just a
answer
dozen.
the question, though, is it better results?
It's peer-reviewed, published data that's out there.
Better results.
That we have better result around the time of the surgery. We have very, very good result toward the, in the long run. But while the patient are getting from the short to the run, they don't have the complication of the open old-fashioned surgery. So not only we achieve better result, we achieve them sooner and safer.
All right, now, let's talk about the pain patient for just a moment. It's very interesting, your take on it. And I even said, how did you develop this empathy? Because you come from a family of pain and you've been in pain before. But you say that unknowingly, these spine surgeons, because they're doing the surgery, they don't know what their life is at home, what the rest of their life is going to be like. But unknowingly, kind of ruining their lives. I think you said close to what I'm just saying now. So the typical fusion surgery can ruin people's lives. Well, elaborate on that.
Yeah, we just watched a testimonial together a few minutes ago. A patient that, is a little overweight. Well, and its BMI is 42, and our society is telling us not to do surgery if your BMI above.
Because he's obese.
Because it's obese, you have to go through more tissue. You will cause so much damage that in the long run, the risk versus benefit is actually not in patient's favor. But that patient has gone 30 years. He says it.
He's in pain for 30 years.
For 30 years. And in the last 3 years, he's in such a pain. He's thinking about ending his life. He's a good man. He's a provider.
That's what he said on the video.
That's what he says.
He said he was told, if you do a fusion surgery, I'm paraphrasing him slightly, they told him, you're going to die.
That's what they're told. And we spine surgeon, we go through the training. One of the most important thing we do, we manage risk versus benefit. We find out how much our procedure is going to help you, what are the risks associated with that, and when is that threshold that it's really not worth to do it for you.
So let me get this straight. If there's 1 million spine surgeries, 500,000 fusions a year, there's probably another 3 million that were turned away. Nothing we can do. Too risky. Because if you're a surgeon, and there's a huge chance there could be major complications, a surgeon doesn't want to touch that patient, right? I'm
the person who get those patients. I'm the person that those patients go after. They are told no by 5 other surgeons that,
too risky.
Too risky. You're too old. You're too big. You have other medical problems, and surgery will kill you. That is when they come to me.
Let's go to that clip. This guy on the bed just had the procedure a couple of days ago, I guess, right?
Just the day before. I did the surgery 2 days ago, and patient went home yesterday.
Let's go to that clip.
You were smiling a minute ago.
Yeah.
How do you feel?
I feel real good.
Now, the surgery was just yesterday. You got one of the biggest surgery anybody can get in the spine.
Yeah.
And we fused multiple of your discs. You had a scoliosis. Mm-hmm. And tell me, how were you before the surgery? How long has it been going on?
Well, I've had back problems for 30 years. I've had 3 different minor surgeries plus a spine stimulator, and nothing helped.
Yeah.
Actually, I actually thought about suicide. That's not an option. I had people dependent on me.
The pain you had in your legs before the surgery, how is it now?
Good.
It's gone?
I can't feel it right now.
Have you already walked?
Yes. I don't feel it unless I move.
Okay.
And it's minimal. It's just those minor surgeries I had. And it's no comparison.
Now, how do you feel?
Good.
Okay.
Spirits are up.
Excellent.
So that's typical.
Well, what's typical about that is they go over a journey. They are sent around. They are told that, you don't need the surgery because surgery is too big for you, or you are too big
But
for
he was
the
30
surgery.
years in pain, about.
Yes, yes.
He missed out. Look, I don't know how old he is. Let's say in the 60s.
Yes, he's in his
So
60s.
from like in his 45, I mean, he missed out on a lot of good years being in
he,
pain.
he lost a lot of quality years that he could have put to good use for himself, for his family, for society. Because at the end of the day, we are less productive if we are in pain for ourselves, for our family, and for our environment.
Pain patients in medicine sometimes aren't even taken that seriously, right?
Now, and in a way, we sort of in medical industry, we produce this kind of patient that they go through this path, and because the solution for them is too big for our expertise level, we just dismiss them, and then the narcotic epidemic is our own doing on the medical care side, because we know that what the problem is, but we are just considering it just too big for the patient to have.
You say that there are well-intentioned spine surgeons that because they're doing it the old-fashioned open way, cutting all those muscles, that they are ruining the lives of these patients. You believe that?
Well,
because they're not knowingly doing it.
No.
But you think it ruins people's lives to get a traditional spine surgery.
Randy,
How could you
I
say
could
that?
speak hours about that, and this is a very complex topic.
Discussion,
These people, these surgeons are well-trained, good-intentioned people. They dedicate their lives to take care of these patients, and but they come back to the point that, first of all, this risk of the surgery are too high. So I'm going to wait 4 years before even I touch you. By the time I start even considering surgery is the last resort for a good reason, and higher the risk of the surgery is, longer I'm going to wait before I put you through that surgery. And what that means for that patient, their marriage breaks down, their lives are destroyed, they lose their job because they cannot show up to work. So
what do you mean marriage is destroyed?
Well, I get often patients where the wife comes and tells me, either you fix him or you take him home. I don't want him.
Because nobody wants to be around a miserable person.
And these people are miserable often.
That's too bad.
Yeah, and these people, they lose their job, they lose their relationships, they get into alcohol and drugs because it is hard to be in pain. These are good people. Very many of them, they have a professional life, and then once they're at the end of the rope, if they're lucky, we are willing to give them the last resort, which is the open old-fashioned surgery.
But the longer you put it off, because you're on all these medications, you have no activity in your life. You're a couch potato.
You're deconditioned. That's the word.
Deconditioned.
Yes.
And so by the time they get to you, is your thing like, I wish I could meet them 10 years earlier?
Yes.
Really?
I wish I would have met them 10 years earlier, have put them through our process, which is not only surgery.
Okay.
We have extensive multidisciplinary path to put them through, but we can figure out these days who's going to benefit from that, and then they don't need surgery. As a matter of fact, most of our patients, we send for other treatment beyond surgery, but once it's clear that other things are not going to help them and they need a surgery, we put them through that process before the decondition, the heart and lung, they run down, and we give them years of life back that they can spend for better things.
Now, in the OR, you tell a story that you told it to me a few minutes ago, that there was an anesthesiologist who is involved in these 6-7 hour surgeries, the traditional open fusion surgery. He saw your surgery. What did he say?
Well, this was a place that
You said, I'm closing.
Yeah. This was a place that, I just started in the university. I started doing this surgery. And it was a 2-level fusion. And 45 minutes into the surgery, I'm telling, as I should, that to prepare the team for what coming next, that we are closing.
Closing means you're going to
meaning that we are done with the major part of the surgery. We are going to close the stitch, or close the skin, and then prepare the patient to be waken up. And in that moment, the head of the anesthesiologist came above that wall that we have between the surgery and the anesthesiology, and he's looking me in the eyes and say, "Are you joking?" And I said, "No, I am. We are closing." And this is something that they're just not used to with their open old-fashioned surgery. And again, this is not it has nothing to do with the specific surgeon. It's about different mode of surgery, like
the technique's different.
Yeah.
You told me on the couch, it's very interesting. You go, Randy, I don't want to make this about me, the Abbasi method, and sure, you've done more than just about anybody else. You're faster than anybody else, more efficient than anybody else. But you made it clear, this is not about me.
Yeah.
I just want people, and I'm paraphrasing slightly, but you want people to know their options, that there's a better way. But more importantly, you want other surgeons to look at this closer.
They have to. This is unethical from us, knowing that we can do better for our patient and not to do it.
Good. You know, there's no crystal ball to know the impact you had on these people's lives. And maybe someday in an afterlife, you get to see all these people saying, you know, this is where my life was going and this is where I ended up. Anyway, I want to thank you for coming on the show.
Well, it's such a pleasure to be here.
I want to let people know that this is a 30-minute interview, but we went long. So if you go to our website at wellnesshour.com or his website, probably better to go to his website, you could see the long version of this. This is a big topic. Also on the Randy Alvarez podcast, I've got like an hour and 20-minute interview with you. But this, to me, for some reason, it's a big deal because it is kind of breaking news that we have today.
Well, it was such a pleasure to be here. And I tell to everybody I talk to, this should be personal because it is personal. By the time you're 70 years old, it's almost impossible not to have spine problem. And you just have to look into your neighbors, families, parents to see somebody who's suffering with the spine problem. So it is personal in a way.
Do you live with a sense of frustration, like that everybody isn't jumping at this?
I live with the sense of that I'm achieving something of importance, and all important things are worth
struggle.
To go through the struggle. If you don't have to struggle for it, maybe it's not that important.
Good. I want to thank you for coming on the show. Good stuff.
Thank you very much for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.